Your interview guide provided so much information that worth's more than the price. I was a bit skeptical at first, but after using it, I will recommend it to anyone that needs a great interview guide.
Imagine for a moment, you're juggling multiple chronic health conditions, right?
Mm-hmm.
And you've got this prescription list that just feels like it's growing every single day.
Yeah, it can be overwhelming for patients.
Totally. And your head's buzzing with questions. What do I take? When? What about side effects? I mean, who's the unsung hero sorting all that out? Making sure you not only get the medicine, but actually, understand how to use it to thrive.
That's a great question.
Well, that's precisely what this deep dive is all about today.
Well,
We're unpacking the indispensable and, frankly, ever-evolving role of the ambulatory care pharmacist.
right. The ones working outside the hospital walls, in clinics, doctors' offices.
Exactly. And we've got a really interesting set of sources. It's actually a comprehensive list of interview questions,
Yeah.
the kind used to find the absolute best people in this field.
Ah, okay. So peering behind the curtain a bit.
Yeah. Our mission is to kind of unpack these questions, to reveal not just what these pharmacists do, but the crucial skills, the surprising insights, and honestly, the deeply patient-centered approach that makes them so vital for your health journey.
Exactly. And you're going to get a completely fresh perspective, I think. We'll go way beyond just a job description. Really digging into the specific scenarios, the unique challenges, and those aha moments that define this blend of, cutting-edge clinical knowledge and real personal connection.
Yeah.
By the end, you'll have a much clearer picture of what it truly means to optimize medication and, dramatically improve lives outside the hospital.
Okay, let's dive in then, starting with the heart of it all.
Yeah.
What really drives an ambulatory care pharmacist? Is it just about counting pills, or is there something, deeper going on?
Oh, much deeper. What comes through loud and clear from those kinds of interview questions is a real passion, a passion for personalized patient care.
Personalized, okay.
And making a direct, measurable impact on people's health outcomes. It's not just theoretical.
Right, so it's less about the transaction and more about the relationship.
Absolutely. Their motivation is about empowering patients, helping them navigate these often really complex medication plans effectively.
Yeah.
Optimizing the whole therapy. And that nearly always involves building long-term relationships. They work mostly in outpatient settings, clinics, physician practices.
So they see the same people over time.
Often, yes. They don't just hand over a prescription. They create tailored medication plans. They educate patients on every detail. They continually monitor progress, adjust things.
Yeah.
It's proactive, an ongoing partnership.
That definitely reframes the role. Okay, and you mentioned it's an evolving field. Pharmacotherapy changes constantly. So, bigger picture.
Yeah.
How do they stay on top of it all, at the cutting edge?
Yeah, that commitment to continuous learning is huge. It has to be.
How does that look, practically?
Well, it's multifaceted. They're regularly attending professional conferences, getting the latest research. They're active in continuing education programs, CEs, as they're called, and they subscribe to reputable journals. Things like JAMA, The Lancet, the places publishing key clinical trials and studies.
So you're constantly learning.
Constantly reading,
Yeah.
synthesizing huge amounts of new data, filtering the noise, and figuring out how to translate that cutting-edge research into practical care for their patients.
Okay, so that covers the clinical side, the advancements. But what about the rules, the regulations? They seem to change all the time, too.
Oh, absolutely.
Yeah.
And staying compliant is, it's non-negotiable.
Which bodies are we talking about?
You've got state and federal regulations from bodies like the FDA, the Food and Drug Administration, overseeing drug safety and efficacy, and the DEA, the Drug Enforcement Administration, dealing with controlled substances. Plus, various state boards of pharmacy have their own specific rules.
Well, that's a lot to track.
It is.
Yeah.
So they dedicate time to CEs, specifically focused on regulatory updates, pharmacy law. They have to stay impeccably informed to practice safely and effectively.
Okay, this is where it gets really interesting for me. Mastering the actual medications.
Right.
A critical role, as the sources point out, is managing therapy for chronic conditions, diabetes, hypertension, asthma, you name it. What does that comprehensive medication management actually look like, especially if someone's got multiple conditions?
Yeah, that's where their expertise really shines. It's almost like they're running complex diagnostics on your entire medication history.
How so?
It involves conducting comprehensive medication reviews, looking at everything, meticulously identifying potential drug interactions or side effects that, frankly, might otherwise be missed, and then optimizing the treatment plans to really improve outcomes. For patients on multiple medications, that term polypharmacy comes up a lot.
Right, taking lots of different pills.
Exactly. It's a huge challenge. So they need a systematic approach, a thorough review to spot, say, duplicate therapies, 2 drugs doing the same thing or inappropriate dosages, and then they collaborate very closely with the physicians to fine-tune those regimens, maximize the benefit, minimize the burden.
Okay, and what about when those, inevitable drug interactions pop up? That can be incredibly dangerous. How do they catch and handle those?
Yeah, this really came through in the interview insights. They often become like medication detectives.
Oh, I like that.
They do a thorough review of everything, prescription meds, yes, but also over-the-counter stuff.
Yeah.
Supplements, even herbal remedies, things patients often forget to mention.
Because they don't think of them as drugs.
Precisely. Then they use sophisticated drug interaction databases and clinical guidelines. One source actually described a case, a patient taking a seemingly harmless OPC supplement. If the pharmacist hadn't flagged it, it could have completely canceled out a life-saving heart medication, a danger the patient had no idea about.
Wow, that's huge.
It really is. So if they find significant interactions, they immediately look at alternative therapies with less risk. If that's not possible, they work hand in glove with the doctors to maybe adjust dosages, change administration times, or set up specific monitoring strategies to minimize any harm.
Beyond the general management, some pharmacists specialize, right? The sources mentioned anticoagulation management. Why is that singled out?
Anticoagulation blood thinners, it's a constant high-wire act. It needs incredibly careful monitoring. Safety and effectiveness are paramount.
So like warfarin.
Exactly. Pharmacists managing warfarin aren't just checking INR levels, the blood clotting time measure. They need to understand how diet, other drugs, everything impacts it.
And the newer ones, DOACs.
Right, the direct oral anticoagulants, they have their own complexities. Requires vigilant review of things like kidney function to prevent serious problems, dangerous bleeding, or conversely, the drug not working well enough.
Okay. And what about those really cutting-edge, often super expensive therapies, biologics and such?
Yes. Managing specialty medications like biologics, that's a big undertaking.
How so?
It requires specific, really in-depth patient education. These regimens can be complex, the side effects potentially serious, the monitoring rigorous.
And the cost.
Exactly.
Yeah.
Crucially, it often involves the pharmacist collaborating with insurance companies, navigating prior authorizations, finding patient assistance programs, basically helping secure financial support. They become vital financial navigators, too, helping patients afford these often life-changing treatments.
Okay, let's shift gears slightly. Let's talk about the human element, the art of connection. We've talked about mastering the meds, but like you said, the perfect prescription doesn't mean much if the patient doesn't truly get it.
Absolutely.
So how do these pharmacists make sure patients genuinely grasp complex information?
A core strategy, almost universal in the interviews, is the teach-back method.
Teach-back. Explain that.
Sure. They explain everything, the drug's purpose, dose, timing, side effects in simple, clear terms. Then they ask the patient to repeat the key information back in their own words.
Ah, okay. So it's not a test.
Not at all. It's a check for understanding, a way to immediately catch any misconceptions or confusion. They also really focus on using simple language, actively avoiding medical jargon, and providing clear written materials, often with pictures or diagrams, as a backup reference.
And what about patients who might struggle with reading or understanding health info, limited health literacy?
Yeah, that requires adapting the approach. For those patients, the focus is on communication that is exceptionally clear, very empathetic, and always confirming understanding, again, using teach-back.
Building trust seems key there.
Totally. Making the patient feel completely comfortable asking any question. Creating an environment where they can talk about their meds without feeling rushed or embarrassed.
Okay, another huge challenge in healthcare. Medication non-adherence, people not taking meds as prescribed.
Oh yeah, very common.
It can happen for so many reasons.
Yeah.
How do ambulatory care pharmacists tackle this? It seems really personal and complex.
It is critical, and it's rarely simple. The first step is always trying to identify the root reasons for the non-adherence.
Like what?
It could be anything.
Yeah.
Unmanageable side effects, maybe the cost is too high, simple forgetfulness, maybe the schedule is just too complicated.
Right.
Once they understand the why, the strategies get tailored. Maybe it's more education on why it's important, framed in a way that resonates. Or discussing alternatives with fewer side effects with the doctor. Exploring financial assistance, suggesting practical tools, pill organizers, reminder apps. Maybe working with the prescriber to simplify the regimen itself.
So definitely not a one-size-fits-all fix. It's about digging into that individual situation.
Precisely. The focus is always on open, empathetic communication, true collaboration with the patient to find solutions that fit their unique circumstances and lifestyle. They're not just dispensing, they're problem-solving alongside the patient.
Speaking of collaboration, the sources really hammer home that these pharmacists are integral members of the whole healthcare team.
Absolutely.
How does that collaboration with doctors and nurses work in practice? Is it more than just a quick phone call?
Oh, much more. They work very closely together, often right there in the clinic. They actively participate in interdisciplinary team meetings.
So everyone's around the table, so to speak.
Exactly. Discussing patient progress, reviewing medications critically, developing comprehensive treatment plans together. It's proactive, coordinated, everyone on the same page for the patient's benefit.
Can you share a concrete example? How does that deep collaboration actually improve things for a patient?
Yeah, absolutely. One powerful example described involved an elderly patient, had severe hypertension, poorly controlled diabetes, and was on a dizzying number of medications.
The polypharmacy issue again?
Exactly. A regimen so complex it was almost impossible to manage at home. The ambulatory care pharmacist, who was embedded in that primary care clinic, flagged it during a team meeting.
Okay.
So working closely with the doctor, they systematically reviewed every single drug, found redundancies, simplified the schedule, consolidated doses, eliminated unnecessary meds while ensuring effectiveness, of course.
And the result?
It wasn't just about convenience. It dramatically improved the patient's adherence because the regimen finally made sense, it was manageable, and the direct result, significantly improved blood pressure and blood sugar control, which led to fewer urgent care visits and hospitalizations.
Wow. That shows the direct impact.
It's a real testament to how their expertise directly prevents complications.
That's powerful. And what about continuity of care, especially during those transitions, like going home from the hospital? You mentioned medication reconciliation?
Yes, MedRec. It's crucial.
Yeah.
They play a vital role in preventing errors during these incredibly vulnerable times.
Why are transitions so risky?
Well, when a patient leaves the hospital, their medication list can change drastically. New meds added, old ones stopped or changed. It's easy for things to get missed or mixed up. So the pharmacist's job is to meticulously review and verify those lists, make sure they accurately reflect the current plan and any changes made in hospital. They address discrepancies immediately. And, crucially, they provide counseling to both patients and caregivers on how to use everything correctly, what side effects to watch for, basically preventing dangerous errors once the patient gets home. They're a vital safety net.
Sounds like they really are the last line of defense sometimes. What about handling, the tough calls, difficult decisions, or even when medication errors do happen? That must be part of the job.
Absolutely. They face difficult decisions routinely, like adjusting a blood pressure med for an elderly patient whose kidney function is declining.
Tricky balance.
Very tricky. Balancing effectiveness with safety, always involving collaboration. And when it comes to medication errors, because they do occur in complex systems, their process is clear and systematic. Identify the mistake, maybe an incorrect dose.
Then what?
Contact the prescribing physician immediately. Adjust the plan. And then, importantly, conduct a thorough root cause analysis. Figure out why it happened.
To prevent it happening again.
Exactly. Implement preventative measures. Maybe it involves tweaking checks in the electronic health record system, maybe adjusting workflow protocols, learning from every instance.
So not just fixing the immediate problem, but improving the system. Is there an example of resolving a particularly challenging situation?
Yes, one interview subject shared a compelling case. A patient was experiencing severe dizziness, fatigue, really debilitating symptoms. Turned out it wasn't just one drug. It was the cumulative effect of multiple medications with overlapping side effects. A real diagnostic puzzle.
So what did the pharmacist do?
Collaborated closely with the physician, methodically reviewed the entire regimen, suggested specific alternatives, adjusted the therapy, carefully stepped down some doses. It was a comprehensive approach. It resulted in a significant improvement in the patient's symptoms and their overall quality of life. It really highlights that clinical judgment and problem-solving skill in action.
Okay, shifting to the modern age. Technology, it's everywhere. How are ambulatory care pharmacists using tech to improve patient care?
Oh, technology plays a huge transformative role now. It streamlines things, improves communication, helps with better decision-making.
Like what kind of tech?
Well, electronic health records, EHRs, are fundamental. Efficient, real-time access to complete medical histories, med lists, lab results. It's all there. They also rely heavily on computerized physician order entry CPOE systems. That helps verify orders, check for interactions instantly, ensure accuracy right when the prescription is written.
And what about reaching patients who aren't nearby?
That's where telepharmacy services are making a big difference. Remote consultations between pharmacists and patients, it dramatically improves access, especially for people in rural or underserved areas. It's a real game changer for healthcare equity.
Okay, thinking bigger now. Beyond the individual patient, how do these pharmacists contribute to public health? Or broader things like population health management?
They make substantial contributions, often behind the scenes. On the public health front, a big one is immunization services.
Right, pharmacists giving shots?
Exactly. Flu shots, pneumococcal, shingles, even travel vaccines. They often manage entire vaccination programs for clinics or communities.
And population health, that sounds more like managing groups of patients.
It is. They get involved in quality improvement initiatives. For instance, implementing medication therapy management MTM programs for groups with chronic conditions, like everyone with diabetes, in a specific clinic.
What does that involve?
Actively tracking key quality metrics, like average HbA1c levels for diabetes control, blood pressure control rates, LDL cholesterol levels, using data to see what's working, what needs improvement.
And the goal?
This proactive, data-driven approach directly helps reduce hospital readmissions, cuts down on emergency department visits across that whole patient population. It improves community health outcomes overall.
This paints a picture of a really demanding but incredibly rewarding role.
Definitely.
So if you had to boil it all down based on everything we've dug into, what are the absolute most important qualities for an effective ambulatory care pharmacist?
Yeah, the sources consistently point to a few core things. First, just practically prioritizing tasks and managing time effectively. It's a busy environment.
How do they manage that?
They have to focus relentlessly on tasks that directly impact patient safety or have strict deadlines, often using sophisticated electronic calendars, task management tools. Staying organized is key.
And patient privacy, obviously critical.
Paramount. Maintaining patient privacy and confidentiality, following IPA regulations to the letter. Always using private consultation rooms or designated areas. Rigorously verifying patient identity, usually with 2 different identifiers before discussing any health information. Respecting privacy at every single step.
What about something called drug utilization reviews?
Yeah.
DURs. Sounds like an audit.
It is, in a way. And it's a vital safety function. Conducting DURs mean systematically analyzing a patient's entire medication profile.
Looking for what?
Potential issues.
Yeah.
Drug interactions.
Yeah.
Duplicate therapies. Inappropriate dosing based on their age or kidney function. Things like that. They gather all the info, use evidence-based guidelines, identify problems, and then proactively work with prescribers to make necessary changes. It's about ensuring every medication fits into a cohesive, safe plan.
Okay, so bringing it all together, if you had to pick the absolute most critical qualities, the essence of a great ambulatory care pharmacist.
Based on this deep dive, I'd say, strong, constantly updated clinical knowledge. That's the foundation. Then, excellent communication skills, talking to patients clearly, collaborating effectively with doctors and nurses. Profound empathy. Meticulous attention to detail because small errors can have big consequences.
Yeah.
Genuine adaptability in a field that changes so fast.
Yeah.
And overarching all of that, a truly patient-centered approach.
Yeah.
Putting the individual person at the absolute heart of every single decision.
Wow. We've really uncovered the incredible depth of this role, haven't we?
Yeah.
It is so much more than just dispensing pills from behind a counter. It's demanding. It's dynamic, built on that deep clinical expertise, that empathetic communication, relentless teamwork, and a real dedication to lifelong learning.
They really are medication experts and patient advocates, all rolled into one.
And for you, the listener, understanding this role, I think, highlights the incredible expertise that's out there available to support your own health journey.
Absolutely. It's a powerful reminder that personalized care, clear communication about your meds, and that team approach, they're all essential for the best possible health outcomes.
So here's something to think about. What does all this mean for how you might approach your next conversation with a healthcare professional, particularly about managing your medications? Maybe it's a prompt to ask more questions. You know, who is looking at your whole medication picture? Or maybe to seek out that kind of holistic, patient-centered expertise that goes way beyond just picking up a prescription.
Yeah, consider all those layers of expertise working tirelessly, often behind the scenes, to ensure your safety and well-being. There's often more going on than meets the eye.